News.
A nurse that has had to hold the hand of somebody when their family members couldn't be there to say goodbye, and that happened over and over and over. I don't think anyone realizes the toll that it takes on them.
For many, they are heroes, to some even saviors. We're talking, of course, about healthcare frontline workers. It's a working sector of the country perhaps most directly impacted by the COVID-19 pandemic.
And as the pandemic wears on, the demand for doctors and nurses is even greater. Our Garrett Hoddle has an update on the travel nurse industry.
You may recall the saying, home is where the heart is. For travel nurses,
honestly, home is where they make it.
Heather is a nurse and recruiter for travel nurses.
Previous to that, I was a pediatric ICU nurse, so I flip in between both.
Logan May, familiar with the position as well.
5 years. I've been a traveler for about a year and a half, 2.
Which has forced her for now to call Midland home.
It's been crazy. Actually, COVID changed things a lot. Pretty much since COVID, I've just stayed out in Midland. I haven't gone to any other places, so that's kind of a bummer.
COVID has been the shot caller in demand over the past year. In regards to travel nurse demand, Baylor Scott & White Health said in a statement they continue working to ensure they have adequate staffing, which includes forecasting and deploying supplemental contract staff as needed. According to FastHalf Travel Nursing Agency, they received a more than 500% increase in travel nurse requests for the state of Texas from 2019 to 2020. This year, changes have been...
There's a small decline, but it's actually a good breather because the need was so exponential that we couldn't catch up with everything. We're seeing that this going well into 6 months into 2021.
But professionals like Kathy Conkey expect demand to continue to be high even after COVID. There's work that still has to be done, and it's in a tough environment right now.
All the other surgeries that must happen, your oncology surgeries, your GI surgeries, and so it's just trying to push through all this healthcare that's really been on the back burner.
For now, they keep battling to keep us all safe. Garrett Hoddle, 25 News.
Garrett, thank you. Now, hospitals typically hire staff based on supply and demand. Travel nurses are called to areas where demand is the highest, but then there's still the issue of a nurse shortage. A few contributing factors impacting the nursing shortage include a significant segment of the nursing workforce is nearing retirement age. Insufficient staffing is raising the stress level of nurses, impacting job satisfaction and driving many nurses to leave the industry altogether. Also, a shortage of nursing school faculty is restricting nursing program enrollments.